10 Surprising Facts about Coronavirus. At Ageusia TV we share limitless knowledge with you. COVID-19 facts that might surprise you. In January 2020, scientists announced that a new coronavirus, SARS-CoV-2, was responsible for an outbreak of respiratory disease and pneumonia in Wuhan, China. Number 1. Anosmia, loss of smell, is a symptom. The most commonly reported symptoms of COVID-19 include fever, cough and shortness of breath. In South Korea, 30% of people who tested positive for the virus said that loss of smell was their first major symptom. In Germany, more than 2 out of 3 confirmed cases included loss of smell and taste. Number 2. SARS-CoV-2 binds tightly to human cells. In 2003, SARS, or severe acute respiratory syndrome, spread from Asia throughout the world, sickening more than 8,000 people and killing more than 700 over a 6-month period. The virus that caused SARS, SARS-CoV, is similar to the one that causes COVID-19. Both are types of coronaviruses, but researchers have recently discovered an important difference that may explain why the new coronavirus is so hard to stop. SARS-CoV-2, the virus that causes COVID-19, binds 10 to 20 times more tightly to human cells than SARS-CoV, the virus responsible for SARS. Number 3. Coronavirus can make babies seriously ill. Compared to adults, children appear much less likely to get sick if they contract the novel coronavirus. Vulnerable to serious illness than older children. Very young, less than 1 year, appear to be more from the records of 2,143 Chinese children. Nearly 11% of sick infants were seriously or critically ill, compared to 7% of children ages 1 to 5 years, 4% of children ages 6 to 15 and 3% of teenagers aged 16 and older. In the United States, from February 12 to April 2, less than 2% of cases were in children younger than 18 years. Of these pediatric cases, 15% were in children under 12 months. Number 4. The COVID-19 virus can live on surfaces. When an infected person sneezes or coughs, the virus can travel from one person to another, either directly, which is why the CDC recommends maintaining at least a 6-foot distance from other people, or via an intermediate surface. The virus can also spread through the air, but this is more likely in crowded, indoor areas with poor ventilation than in areas with plenty of outdoor air and fewer people. Researchers have found that the virus can live up to 24 hours on cardboard and 2 to 3 days on plastic and stainless steel. Number 5. People who don't have symptoms can spread the virus. 1/3 of 565 Japanese citizens who were evacuated from Wuhan, China in February that tested positive for coronavirus infection never developed COVID-19 symptoms. The CDC estimates up to 40% of infected individuals do not experience symptoms. Number 6. People with type A blood may be more susceptible to infection. A Chinese study of 2,173 individuals who were hospitalized with COVID-19 found that the proportion of sick people with type A blood was significantly greater than researchers would expect based upon the percentage of people with type A blood in the general population. The study also found that there were fewer sick people with type O blood than would be expected. Number 7. You may already have been infected. Some people never develop symptoms. And some people who had what they thought was a bad cold or the flu may have actually had COVID-19. Scientists developed tests that can detect SARS-CoV-2 antibodies in the blood, which is evidence of past infection with the virus. Number 8. Some people with COVID-19 have digestive symptoms. Cough, fever and shortness of breath are the most common symptoms of novel coronavirus infection, but many people also experience digestive symptoms, including lack of appetite, diarrhea, vomiting and abdominal pain. According to a study published in the American Journal of Gastroenterology, 48.5% of 204 people admitted to the hospital with COVID-19 had digestive symptoms. Number 9. Reinfection may be possible. If a person gets COVID-19, are they immune to future infection from SARS-CoV-2? And how long will immunity last? Across several countries, doctors have confirmed less than 100 cases of SARS-CoV-2 reinfection. Number 10. The FDA has approved the first targeted COVID-19 treatment. A COVID-specific drug, bamlanivimab, has emergency use authorization, EUA. It is for people with mild to moderate COVID-19 at high risk for developing severe disease. In clinical trials, the drug, a monoclonal antibody that targets the SARS-CoV-2 spike protein, reduces emergency room visits and hospitalizations. The US FDA, Food and Drug Administration, also authorized the antibody cocktail former President Trump received when he developed. Thank you for watching our educational video. Please subscribe to our channel. Hit the notification bell icon below to receive alerts whenever we post new video content.